Hi everybody, Dr. Baumholtz Plastic Surgery. Today the FDA has made a recommendation for more stringent warnings for patients who are considering breast implant surgery. This follows recent news about a rare form of breast cancer known as BIA ALCL and an even more difficult to define set of diseases known as breast implant illness, BII. Let me address some of the concerns that are raised by today's news release. Number one, they talk about educating women about the risks of having breast implant surgery. If you are visiting with a board-certified member of the American Society of Plastic Surgery or the Aesthetic Society, chances are you will receive a standardized consent form made originally by the ASPS, which reviews almost all of the risks that are involved in having breast implant surgery. You can't do surgery without scars, and there are risks to having an implant that are associated with a mechanical device. Namely, that device can fail, it can leak or rupture, there can be infection, there can be a host of things, all of which we review in detail, great detail, when you come for your consultation here. Okay, BIA ALCL. Let's put some things in perspective. There's roughly 3,000 to 5,000 cases of this anaplastic large cell lymphoma, or BIA ALCL, in the world literature. And there are roughly 400,000 breast implant cases in the US alone every single year. About 300,000 cosmetic or aesthetic, and 100,000 for reconstructive purposes. Okay. In the cases where cancer was identified associated with an implant, in all of those cases, the implant was textured, or at least where it could be identified, it was textured. We're not aware of cases being associated with smooth implants. At Baumholtz Plastic Surgery, we only use smooth implants. Next, BIA ALCL. BII, breast implant illness. And I did a video on this a number of weeks or months ago. And this is a constellation of symptoms that women are attributing to their breast implant. The difficult part about that as a plastic surgeon is listening to the symptoms that these people have and trying to really correlate it with an implant. It's not enough to say that I felt this way when I had the implant and I felt better when it got removed. In fact, there was a story of a woman who testified in front of the FDA where she felt that the implant she received after her breast cancer treatment left her in a fog for the greater part of a year until the implants were removed. I was a general surgeon in my past life before I was a plastic surgeon, and I can tell you that most women who have breast cancer who receive a double mastectomy, need that level of treatment, will often get chemotherapy and maybe even radiation. I think it's pretty easy to imagine how you might be in a fog for the greater part of the year as you go through constant doctor visits, medical oncology, surgical oncology, maybe radiation oncology. So the notion that as the year is ending and your anniversary is coming up and you're starting to feel a little, stronger and the implants are removed at that point, that may just be a correlation. True and unrelated is what we like to say. That is not to minimize the symptoms that people with BII have. It's just to say, in all honesty, from a surgical perspective, it's hard to connect one with the other. I'm all about educating patients, and I'm all about making people aware of the choices they're making. And so I agree with the notion the FDA is pushing for more transparency. However, I will say this. If you are visiting with a board-certified plastic surgeon, a member of the ASPS or the Aesthetic Society, I would all but bet you're getting that kind of informed consent already. If you'd like to know more, you'd like to come for a visit, if you'd like to be considered for breast implant surgery, please come visit us at Baumholtz Plastic Surgery. This is Dr. Baumholtz. Got that wrong. This is Dr. Baumholtz on a very serious topic. This is Dr. Baumholtz, and I look forward to meeting you in person. Take care.